Hey everyone, this is the last chapter before our midterm. We're going to go over bioethics issues. So your midterm is going to be next week. Be on the lookout for an email from me. I'm going to give you all the instructions for that, for how to prepare for that. Okay, bioethics issues is the study of ethical issues that are caused by technological and scientific advances. So as science and technology continue to advance, the bioethical issues that come from that are becoming more and more complex also. Sometimes, it's advancing so fast that the government isn't able to keep up with addressing the issues, like with public policy. Okay. There are three categories of bioethical issues we're going to talk about in this chapter. For each of these categories, there is a table in your book that lists out the ethical concepts or components of each of these. So the first one is issues related to the beginning of life. So that would be family planning, abortion, perinatal ethics, eugenics, okay? Most of these probably bring up strong emotions for you because they ask us to question our fundamental beliefs and their values, our values about reproduction and all of that, okay? Before we go into each of these, I just want to say that all of this material is coming straight from the book. I'm not trying to convince anyone one way or the other on any of these matters, okay? Family planning refers to trying to control your family size or the timing between children. You can do this by using contraception, so trying to prevent pregnancy in the first place. The ethical issue with contraception is that it interferes with the purpose of sexual activity, which is creating life. On the flip side, others are big advocates for contraception because they say, we need to control our population growth because of how we're affecting our planet's resources. And others like it so that women can make their own decisions about their bodies, okay? Probably the biggest problematic ethical issues with contraception, let's see, is dealing with minors. Let's see. Yep. Dealing with minors because the question is whether they can properly consent to using contraception. So a parent has to consent for them because of the concepts of best interest standard, and paternalism. Okay, here we go. I was on the wrong side. Sorry. And if you remember what best interest standard is, or paternalism about was that last week? Or if you don't, rather, go back and review my last presentations, okay? Most states have passed laws allowing minors who are mature and able to give consent the ability to get contraception without parental consent. But even though this issue is addressed by laws, it's still an ethical issue that causes a lot of debate among people, as I'm sure you all know. The ethical concepts for contraception are autonomy, best interest standard, paternalism, and right to personal liberty. Now, on the other end would be adoption or infertility treatments as a way to increase family size. So ethical issues with adoption would be if and how much of the birth parent's information or genetic information should be disclosed. Or if the adoption does not succeed, can the adoptive parents return the child? And if so, what are the circumstances that would allow them to do that? For infertility treatments, the ethical question is if it's responsible ethical conduct to use these scientific procedures to facilitate conception. Excuse me. So the ethical concepts here are autonomy, beneficence, and non-malfeasance, and then justice and rights, excuse me. Here they are. All right. The next family planning issue, ethical issue, is abortion. Although it can also be considered part of family planning because it's used to reduce family size. There are three types of abortion. naturally occurring or a miscarriage. It's also called a spontaneous abortion. Therapeutic, which is done for medical reasons, and personal or elective abortions. So the therapeutic and elective ones are the focus of ethical concerns. The debate around abortion really boils down to the question of when human life begins. Some believe it begins at the moment of conception, making the fetus a human life worthy of being protected. Others think it does not begin at conception and that the fetus is not considered a human until birth, and that the woman should be able to decide or be autonomous about what happens to the baby. Some people think abortion is wrong, but feel that certain situations, such as rape, would justify an abortion. And then others think that abortion is not wrong, but that it is misused and wrongly treated as another form of birth control. Okay. All right. The U.S. Supreme Court legalized abortion in the case of Roe v. Wade from a rights perspective, saying that state laws restricting it could impair a woman's personal liberty and right to privacy. They decided that abortion could be allowed in the first trimester and allowed states to decide for themselves for the second and prohibit it in the third. But as we all know, Roe v. Wade was recently overturned. We're not going to get into that too much, okay? Other issues at question are, what is the male's role in regard to abortion? Should they have a role in the decision-making process? Also, how should informed consent work with a minor? Should fetal tissue from an abortion be used for stem cell research or therapeutic purposes? What role should politicians play in this debate? Okay, and ethical concepts at play here are autonomy and right to personal liberty. Okay, next family planning issue is perinatal ethics, which has some of the same concerns talked about with abortion. So this is involving the period surrounding birth. The ethical questions here center on prenatal testing, genetic screening, and prenatal surgery. So prenatal testing is used to detect, fetal abnormalities, and they can do this by performing an amniocentesis, a CVS, or chronic villus sampling, or by doing an ultrasound or a sonogram. Each of these can pose risks to the fetus, and some people don't think the test should be performed because it puts the mother in a tough ethical position. And the fact that they're not always reliable. Sometimes there are false positives of a condition that are reported, and then the baby ends up not having that condition, okay? Genetic screening is a test that the patients can undergo to have their genetic makeup looked at to see if the baby would have a predisposition for a certain disease or abnormality. The ethical concepts here are autonomy and personal liberty, and there are concerns that doing genetic screening promotes abortions. Some abnormalities that are found can be corrected through prenatal surgery, which is done on the fetus before they're born, so still in the mother's belly. But these are performed very rarely because they're very high risk. Okay, the last family planning issue is eugenics, which refers to the effort to improve the human species by controlling the hereditary factors in mating. So it's basically a breeding practice to make superior offspring. The most famous example of this would be Nazi Germany, right? Hitler wanted to make a superior race to get rid of anyone that he deemed unworthy of life. Okay, so this was people with mental disorders, people that were deaf or blind, anyone with any musculoskeletal issues, and the list goes on. So there are two different methods of eugenics. One is to encourage people that were considered desirable to have more babies, and the other is to sterilize people that were considered less desirable so that they cannot have babies. The ethical issues here would be judging others inferior, involuntary sterilization. This violates autonomy, and malfeasance, which, if you remember, means to do no harm. Okay, moving on to the next category, which is issues related to sustaining or improving the quality of life. These are tricky because what one thinks is an improvement to quality of life could be different for someone else. Okay, the first ethical issue is dealing with HIV and AIDS, which are two of the most significant health threats worldwide. They have even caused epidemics in some parts of the world. Causes of HIV and AIDS would be from drug use, sharing needles, receiving tainted blood in a transfusion, unprotected sex, or any other direct mucus-to-mucus contact. Because there's no vaccine or cure, the focus is on containing the spread of the infection. Ethical issues here, methods to contain confidentiality and duty to treat. So, several methods to contain the infection are being used, including clean needle exchange programs for drug users, screening of blood supplies, and promoting abstinence and using condoms. So these methods can compromise autonomy. The person can choose to engage in these behaviors. The double effect principle for, the example of the clean needle exchange. Does the attempt to reduce the spread outweigh the outcome of allowing them to still do these injectable drugs? And then distributive justice, so screening all of the blood versus just a sampling. Okay. There's also the question of confidentiality because of the stigma of the disease. So while the patients deserve to keep this information private, the flip side is that health authorities need to know the extent of the disease's existence in their community and what resources they need to combat it. So many health authorities require healthcare providers to report the test results without revealing the patient's identity. And they can't release the information to anyone without the proper consent. Okay. Another issue is that some doctors have a hard time separating the fact that the patient that is suffering from HIV or AIDS with whatever caused it in the first place. And also they could potentially catch the disease from the patient. But there are a lot of precautions that are used now to prevent that from happening. Doctors do have a duty to treat the patient, which is outlined in all of the professional associations' codes of ethics, okay? The next issue is organ transplantation, which is one of the most effective developments in improving the quality of life, right? Transferring an organ or tissue from one person to another from part of your own body to another place, okay? The number of tissue and organs available has never been enough to meet the number of people that need transplants. So there is a question of distributive justice. How do we decide who gets the organs that become available? And the concept of payment, which is dealing with the problem of people selling organs for profit, which most nations have created laws regarding that. The federal government funds an organization called the United Network for Organ Sharing that acts as kind of like a clearinghouse for getting organs and deciding who will receive them. Okay, the last issue with sustaining or improving life has to do with genetic science. So while the progress in medicine over the past century has been due to scientific advancements and new and improved technologies, the future progress of medicine seems to be focused on genetic science. There are several efforts in place. The first is the Human Genome Project, which is an effort to map out the genes in your DNA in order to hopefully find new ways to diagnose or treat and maybe even prevent diseases in the future. Another effort is gene therapy or genetic engineering, which involves genetically altering organisms. So this would be, they're doing this on mice or other animals, not humans right now, for various purposes. So to try to cure a disease. A lot of these experiments have not been successful though. There's also stem cell research, which is the study of special cells that don't have a specific function that has the ability to renew itself and turn into specialized cells, okay? They can use adult cells, which are rare and difficult to identify, or early human embryos taken from after an abortion. These are less rare, they're easier to identify. The ethical concerns here are similar to those with abortions. All right, the last category is ethical issues related to death and dying. So the increase in educational levels and medical advancements has led to more and more people contemplating the meaning of the term quality of life. Some people plan ahead of time, like what kind of care they want to have or not have at the end of their lives by using advance directives. This is a legal document. There are two types. A living will is used if the patient is incapacitated, like in a coma or something. And then the durable power of attorney for healthcare is a document that's naming someone else to make any health-related decisions for them if they become incapacitated. And it usually tells them exactly what they want. If it doesn't, the person called a proxy is to use the best interest standard to make those decisions. So what has this person expressed that they want if they were ever in this situation? Euthanasia refers to the act of causing death painlessly to end suffering. There are two types here. Passive, meaning no heroic or extraordinary measures are taken to preserve life. People can specify in the event of them coding if they want the medical staff to resuscitate them or not, called a DNR, do not resuscitate, which goes directly against what medical professionals are trained to do, right? Also, the definition of extraordinary measures differs between healthcare professionals. So this can cause confusion in, the panic of a moment, like when someone codes. So now how they're trained to look at the person's chart or their electronic health record to see, it'll say DNR or full code, meaning they want all measures taken to revive them. Now, active euthanasia is the act of speeding up the process of dying by using some sort of prescribed medication, usually administered by a doctor, but there are some cases where family members will do this, and they're called mercy killings, which causes some people to be outraged. Some people accept it. It just depends. Some people look at euthanasia from a deontological approach if the patient has made their wishes known, okay? Some people see it through a utilitarian approach, seeing it as compassionate for people that are suffering, right? To put them out of their misery. And then there's the double effect principle, giving someone that is terminally ill strong narcotics to relieve pain, which is the intended outcome, can be justified even if they die. Of course, religious beliefs can affect where you stand on the issue. All right, and the last ethical issue is withholding treatment. The patient or their family member doesn't give permission for treatment, which can result in death or decreased quality of life. So, for example, a cancer patient not wanting to receive chemo, having a DNR, not wanting a feeding tube, or not wanting to be put on a ventilator, okay? Or withdrawing treatment. So the decision to stop a treatment or care, which usually results in the patient's death. This concept is referred to as the right to die. Okay, if the patient is competent and of sound mind, then the right to personal liberty is present. If the patient is incapacitated, the best interest standard applies here. All right, and that's all I have for y'all today. See y'all next time.